Hey, what's going on YouTube, everybody? Thank you for joining another episode of Cipher Knowledge with Chrissy. I have an amazing guest, but before I introduce him, I have to pay my dues. So I just want to remind you guys to make sure you tune in to Around the Turnbuckle Saturdays and Sundays at 6 p.m. Make sure you tune in on Tuesdays at 6 p.m. for home team sports and entertainment. And on Wednesdays, 8 p.m. Eastern Standard Time, you're going to get Spitting with Spitter. But right after this show, he has a special one. So 10 o'clock tonight, make sure you tune in for Spitting with Spitter. And on that note, I want to introduce my guest that I'm so excited to have on the show. The subject matter is very personal to me because of my journey. But Dr. Sabharwal, thank you so much for joining me. Can you please introduce yourself to the audience?
Hi, Chrissy. Thank you so much for having me. Well, my name is Dr. Avishkar Sabharwal. I'm a board certified obesity medicine specialist and lifestyle medicine specialist. So I've trained in India and in internal medicine. I've trained in the US in internal medicine. Then following that, I got my certification in obesity medicine and lifestyle medicine, which I'm very passionate about. And, we were just discussing about all of this just prior to starting, and it was amazing. You've had a fascinating journey.
I definitely have. But before we get there, there's always the first question and the last question is the same for every guest that comes on. And because I always want to know, what inspired you to specialize in obesity and lifestyle medicine?
So, just like you have a personal journey, I've had a personal journey. And that's what kind of got me going on this path, actually. When I was in India, when I was doing my residency in India, really, I didn't know about this. So honestly, in medical school, neither in India nor over here, nobody's taught about obesity medicine per se. We know about obesity, but we don't know about the intricacies of obesity itself. And the impression that I had was all throughout my training was that it's somehow supposed to be my fault, and the onus is always on me, and then it's a lifestyle disease, so it has to be cured by lifestyle changes. Only. So, I made some lifestyle changes, and I was lucky that those lifestyle changes worked for me. But then and I was able to sustain the weight loss. But after that, I got really interested in obesity medicine, and I honestly just Googled. I was like, let me just see if there's a thing called obesity medicine. And
so there was.
And then there was. So I was like, I need to do this. So what happened was, at that point in time, I was in India. I just finished my residency in India. And I reached out to people over here and to see if I could certify in obesity medicine here. And they said, well, you have to be trained in the US to do obesity medicine. Now, I didn't come to the US just to be trained in obesity medicine. I happened to come here. And it was like, I wanted to do this, so let me just do this. And when I did it, I was amazed. Like, there's so much of information out there that I don't know about, and having done residencies twice, in internal medicine, I didn't learn about the stuff that I learned when I was learning obesity medicine. So I was really, really amazed at the research that's been done in all of this, and really, it's become a big passion of mine to kind of try and spread the word and spread the message about this.
And I think it's so important. Thank you for doing the work that you do, because, here in America, the obesity rate is astounding.
Oh, yeah, it is.
And it's definitely is lifestyle. So I definitely, if you don't mind me asking, how much weight did you lose?
I lost about 40 pounds.
Okay. So me, it was at 60. So some of my viewers know that for 14 years I was diabetic on insulin. And I decided after my grandchildren came into the world that I needed to change my lifestyle. Like, I needed to change what I was doing, because I wanted to be here to see them graduate and go to school and get married and do all of those wonderful things. So I pushed myself, and I lost 60 pounds. And was able to maintain and manage, maintain and manage my weight loss, as well as keep in control my diabetes, where I no longer needed to take any medicine for it. I do remind people, they're like, oh, you beat diabetes. And I do remind people, it's always knocking on my back door, right? It's always knocking on the back door. Yeah. And I have to be diligent and motivated and disciplined in making sure that I keep up with my lifestyle. The change, because it'll all come right back, and with a vengeance, right? So I know we want this to be an organic conversation. That's what I love. Although I do have some questions put to the side, but I like they're like I know, and we were like we're gonna have an organic conversation in pre-show, but like these are like my questions that I have for you, and I think so many other people have the questions too. So for me, I am obsessed with the scale. Like every morning, I can get on a scale, and I'll be so upset. Like, did I pee enough? Did I drink too much last night? Like, why is it 2 pounds heavier? Like, did I have too much salt? And do I have edema? And that's why? And is it cardiac disease now? Like, all these things. So I focus on the scale. And I, for me being a nurse, I know that it's not a valuable tool all the time. It's something you should use, but not. So you tell me, doctor, you're the doctor.
Well, I mean, is it useful? Yes and no. It depends on how you use it, right? So it's a tool. It has to be used the right way. Now, if you measure your weight every day in the morning and then later in the evening and then later at night, even during the day, your weight is going to change, right? So it's very variable. Even from day to day, it's going to change. The important thing to understand is to not obsess about the number on the scale as long as there's a downward trajectory. So even if you check it weekly and it's going in the right direction, that's good. And even, you know what, if there's sometimes people don't lose weight, but they don't gain weight, and that's also a big win. So people discount the fact that they've not gained the weight, but that's also important to understand, because when you're fighting this fight against obesity, which I just want to let your viewers know that it is defined as a chronic disease by the World Health Organization. So it is a disease that needs to be treated. How you treat it depends on the patient.
So it's different. It's different for everyone. So there are some other ways we can measure our body weight. What are those ways, and are they easily accessible?
Okay, so yeah. So the easiest thing that you can do besides checking your weight is checking your waist circumference. Okay, and now different populations have different waist circumferences that, cutoffs. But in the US, we talk about, 40 inches for men, and I think it's 35 inches for women, or maybe the other way around. Don't quote me on that. I don't remember that. But the other thing that we do use is to define, but that's not used to define obesity. That's basically to see if patients have central adiposity or not. Mm-hmm. But by central adiposity, I mean if they have like quote unquote a pot belly or not.
Yeah.
Right? So just
all the fats in the belly.
Yeah.
Yeah.
But really, if you so the definition of obesity, actually, it's not just the BMI. That's the common thing that everybody uses, right? So BMI, if your BMI is above 30, you're considered to have obesity. Now, I say have obesity and not be obese. There's a very big difference here. When you have, so you don't say a patient is hypertensive. You say a patient has hypertension, mm-hmm. right? So there's a difference there, because you have to acknowledge the fact that it's a disease and somebody's suffering from that disease. And that's what we call, patient first language, basically. So that's very important to understand that and acknowledge that fact. Now, the BMI, of course, above 30 is considered to be, anybody having a BMI above 30 is considered to be suffering from obesity. Again, it's not a very accurate measure, because somebody who's very bulky, who's very muscular, can have a higher BMI, and that's obviously not if patient doesn't have obesity. But there is another thing that you can do is check body fat percentage. And now a lot of gyms have bioimpedance machines. A lot of weight loss clinics run by physicians who are trained in obesity medicine. They also have these bioimpedance machines that we use to check the body fat, see how the patient's body fat percentage is changing over time. Now that also, varies with the day, varies with your hydration, with what you had for last meal, of course. But, as long as we're seeing a good downward trajectory, that's good. So, for women, fat percentage more than 32% is considered to be suffering from obesity. For men, it's more than 25% is considered to be obesity. So yeah, so that's another way of actually defining obesity. And then the most accurate way really of knowing where you're fat is, the DEXA scan or MRI. But that's usually used for research purposes, so we don't necessarily do that.
So and my scale has that thing that you step on and it does everything for you, right? It does I think your bone, not the bone density, but like your muscle mass.
Right.
And
So that's so it's a bioimpedance scale that you have.
yeah. I don't
So
believe it. I'm like, how can you really tell just by you stepping on it?
Well, so what it does is actually it sends a very small amount of electricity through your body. So what happens is that electricity travels through your body, it forms a closed circuit, goes down, and at the speed at which it's traveling, it kind of just calculates based on that. Now, again, all of it depends on the quality of the instrument that you're using. It has to be calibrated. It has to have had proper, technical calibration. You can find these things off of the internet very easily.
Yeah.
But you really have to have a good quality machine, because a good quality machine really is expensive, and then you'll find it in the clinical practices.
My friend Y says all my fat is in my stomach area. So you can chime in and tell me as well. So I know that my friend Y is Latin, right? And as far as the demographics, right, for diabetes, it's usually the Latin, Asian, and American Indian communities, right, that have the high demographics of diabetes. And diabetes usually presents itself mostly in the belly fat, right?
Yeah.
Like you have more belly fat than you do arms and leg fat. That can be an indication of maybe wanting to go check with your doctor and get some blood work done. Tell me if I'm wrong.
Well, it's interesting because, it depends on what type of diabetes you have. So if you have type 1 diabetes, you'll usually be very skinny. But if you have type 2 diabetes, you have what we call insulin resistance. And basically what insulin resistance does is insulin is doing its job in the other tissues. That is, it's storing the way insulin works essentially is that you give insulin, it kind of takes the sugar out of your blood and just puts it in your fat store. So that's why you'll see that, they have higher insulin levels, and because of the higher insulin levels, they're having this abdominal fat, and that it's insulin doing its job, really.
So, and I know I didn't put this on the list, but since we're kind of in that realm of things, what is metabolic syndrome?
So, metabolic syndrome is actually, it's a conglomerate of different things. So it takes into incorporation. So as far as the definition goes, it's really 3 out of the 5 things. That is your waist circumference being higher, greater than, again, 40 inches and 35 inches, I believe. 40 inches in, I think it's 40 inches in women and 35. I just always. Yeah, but anyway. So that's one. One of them is your triglyceride levels being high, more than 150. One of them is your HDL levels being low, less than 40 in men and less than 50 in women. One of them is your blood pressure being high, or you being on a medication for blood pressure. And lastly, you have a higher fasting blood glucose level above 100, or you have diabetes. So really, all of these, you have 3 out of these, and then you're kind of considered to have metabolic syndrome. So this is actually a conglomerate of all of these things. But it's what's the treatment for metabolic syndrome? Really, there's no one treatment per se, but you have to treat these individual things. Now, so what's the significance of metabolic syndrome? Really, a lot of studies have been done on metabolic syndrome, and seeing how it relates to cardiovascular disease and not how it doesn't relate to cardiovascular disease. Like there have been like a huge meta-analysis that was done from China. Like they had, I think they looked at like 4 million or something like that, a huge number of patients all across. And they found that, and not only in China, they've been done over here, there have been meta-analyses done over here, there have been big studies that have been done. And basically they find that if somebody has metabolic syndrome, their chances of getting cardiovascular disease, their chances of getting strokes are higher, their chances of all-cause mortality higher, all-cause mortality meaning deaths from any cause are higher. And not only that, if you have, as the number of components of metabolic syndrome increase, so for example, you have just 1 component, you have 2 components, 3 components, 4 components, 5 components, and as the number of components increases, your risk for all these things increases. Absolutely. So it does have its significance.
Yeah, absolutely. And it's so funny because you'll hear when I do with my home care patients, and a lot of them are diabetic, like I try to correlate it with them, and I'm like, yeah, usually someone who's diabetic, you're gonna see them have low HDLs, high LDLs, like it's gonna kind of, and just all go in together. You normally see them on the Vastins, the statins, and all,
Right.
and I'm like, yeah, they kind of go hand in hand, but trying to teach an 80-year-old to take insulin, they don't want to do it, right? They don't want to have anything to do with it. So I want to talk about diets, right? So
My favorite topic.
like we were talking about pre-show. I've done diets. I've done the Weight Watchers. I've done the calorie deficits. I've done all of those things. And it wasn't until I really made a new relationship with food, like threw away everything I knew about food, put it in the garbage, and restarted from the beginning and retaught myself what nutrition really is, that I really started to lose the weight and feel healthier. Not just lose weight, but feel healthier. So what's your take on diets? Like, are they fast, helpful jump starts, like, short term, long term, what's going on?
So I don't like the term diet, honestly, because the diet, when you talk about a diet, it really kind of signifies that it's going to be short term. And when you do the diet, you're done with it, and that's the end of it. And it'll never work like that. It has to be long term. So, but we talk about, these fad diets that come about, Whole 30, this and that, whatever. So honestly, there was a study actually, A to Z trial that was done, and that looked at all of these diets. They were like looking at a huge number of diets, and which one they tried, essentially trying to ask the question, which one is the best diet to be on, right, to lose weight. And what they found was really, it doesn't matter what diet you're on, as long as you stick with it, it doesn't matter. So sticking with it was the key. So it really depends what you can do, but you need to just do it consistently. And that's really, really important to understand, because a lot of times what happens is you start seeing some results initially, but then you're like, this is too difficult for me to do. And then you just quit. And then you just try something else, and you're like, this is too difficult for me to do. And then you just quit. So you have to find something, some way that's going to be sustainable for you. And it doesn't have to be a ketogenic diet. It doesn't have to be whole food plant-based diet. It doesn't have to be a carnivore diet. It can be any of these things, none of these things, a mix of these things. Whatever works for you, as long as it has those basic components of a healthy diet, it should work.
And and like I was saying earlier, it's something that you're going to stick to, right? You don't want to do a diet like a keto diet where it takes all carbs out, and you love carbs, right? And now you're stuck with this.
Well, if you love carbs, you have to love the right kind of carbs. I'm going to interject there.
Right. But I believe with the keto, like, you can't even sneak, like, it's, and my thing is, that's not going to be one that you love, right? That's not going to be one that you're going to want to.
It's different, because the ketosis state, so the ketogenic diet itself, the goal of the ketogenic diet is actually to produce a state of ketosis in you, right? So what a state of ketosis does is basically your body starts producing ketones. Now, ketones are produced from fat. So essentially, fat is being used as a fuel. Because you're on a low-carb diet, obviously, the glycogen in the body has been used up. Now, your only next source of fuel is your fat, so the body starts using the fat, and your ketones are produced. Some people love it and swear by it, and works great for them, because initially they'll go through this horrible phase called the keto flu, where they have a foggy brain, they're just tired, they feel like they're having a flu-like symptoms, aches, pains, whatever. But after that, they kind of sometimes get a lot of clarity. Like, they're very alert, very focused. Their hunger subsides, because ketones actually cause suppression of hunger. So for some people, it may work, and it does work, and that's why it's so successful, because a lot of people find success with it.
So what about that fat balance with it? Because, this kind of leads us into the macro stuff, right? Because I've done how I think I ended up breaking it down was something like 40 carbs, 35 protein. No, 40 protein, 35 carbs, 25 fat. I think that's how, like, I kind of was counting my stuff, just to, make sure I was getting a healthy balance with everything. Because funny enough, I got rid of the rice and the potatoes. they're like occasional. They're like ooh, I have it, and
You know,
it's
it's
usually
interesting you
brown
talk
rice.
about getting rid of rice and potatoes. I don't know if you've heard of Dr. McDougall. He talks about the starch, using the starch, starch method or something like that. He calls it.
Really?
Yeah.
You
So
know,
I'm telling you,
pasta.
well, pasta is it's different territory. Again, it depends. When you're looking at macros, you're looking at it from a very different perspective. The way I look at it is this. Uh, Rather than, we in science have a habit of breaking things down to their minutest levels, and we take foods and we break them into macros, and we take macros and we break them into something else, and this and that. But really, how those macros interact in that food substance is very different, depending on the food substance that you're eating. If you're eating a donut with the same amount of carbs versus you're eating broccoli with the same amount of carbs, the way they work is going to be very different in your body, even though the macros are going to remain the same. So really, it all depends on it. It's not as simplistic as macros, and it's very simplistic if you look at it. You just have to look at the foods that you're eating, and that's about it. So counting carbs is important, especially if you're on a ketogenic diet or a low carb diet. You don't even have to be on a ketogenic diet. You can be on a low carb diet and do well. But it depends on, you have to eat the right kind of carbs. It just cannot be
Right, and
carbs.
so there's something for the viewers, if you're watching, there's something called the glycemic index, right? And that's whether if you're going to have a carb, you want a carb with a lower glycemic index than higher, and that's because the way it's going to distribute the sugar throughout your body over.
Well, I'm going to caution you there also when you say that.
Oh, okay. Let me know. Come on, that's what I'm here for.
We talk about the glycemic index. It's funny because we recently did an episode also. I did an episode on my podcast on glycemic index, and really, when you talk about glycemic index, it's all good till you look at fructose, because fructose has a very low glycemic index.
Oh, okay.
So when you look at fructose, what ends up happening is it's a different kind of a sugar. Most of your sugars are metabolized. They're basically just broken down in your gut, and then they're absorbed. But fructose really goes directly to your liver, and that's where it kind of gets processed and metabolized, and it causes deposition of fat in the liver. And what that causes is insulin resistance in the liver, and so it's not really good for you. Now, well, the next question is, well, all fruits have fructose. What about that? Well, it also depends on the amount of fructose that you're eating. So if you have something which has a high amount of fructose, with not a lot of fiber attached to it, so obviously the absorption is going to be much more fast. And what ends up happening is when it's absorbed that fast, the rate of metabolism slow, or it's obviously going to get overwhelmed, and that's what happens. So that doesn't happen with the fruits, but it can happen with other processed foods that have the fructose. So even though it has a low glycemic index, and I think that's how it was initially marketed, because when this whole glycemic index.
Yeah, absolutely right. So you want something with higher dietary fiber. Anything over 3 grams, 5 grams?
Well, ideally you should be eating about.
This is why I say you guys want to watch, because I even think I got it right, and apparently I don't.
Ideally, in a day, you're supposed to be eating about 40 grams of fiber. And honestly, if you're just eating like a whole food diet, a whole food, whatever, whether it's plant-based or not plant-based, well, fiber is only found in plant products. So for you to have fiber, you have to have plants. There is no fiber in animal products. So you have to have enough plants to actually get to get your fiber. So yeah.
So we have a question, and this is my friend Dwayne. He said, I was on a diet for 2 weeks, but ended up gaining weight. How does that happen? I'm going to let you answer, but then I'm going to answer with my smart ass answer. So you
So he was on a diet for 2 weeks. I think that itself tells you, right? It's 2 weeks. You didn't stick. Well, actually, I don't know. I don't know what diet he was on. I don't know what he was doing, not doing along with the diet. And when we talk about lifestyle medicine, there are 6 pillars. And even when you look at obesity, it's not, we look at food and exercise. And I think my guess is where this question is coming from is, the calories in, calories out model that we talk about. And I'm just going on on a hunch here that that's
Mm-hmm.
probably where it's coming from. But really, it's much more complex than just calories in, calories out. The whole concept of calories, it's true, but it's not the whole picture. It's not the whole story. What ends up happening is, I just like to give this very simplistic, example. When you eat something, we have to move our bowels every day in the morning, right? What are calories? Calories is basically it's a measure of energy. So when you take anything, you burn it, and what ends up happening is heat is produced, and that heat is measured, and that heat is in a laboratory, and that heat is basically energy, and we call it, we term it in terms of calories, and that's how we know what are the calories in any XYZ food product, right?
Mm-hmm.
So, but what ends up happening is when you eat, you have to go and move your bowels in the morning, and then when you move your bowels, you do evacuate some stuff out there. Well, we all undermine the fact that there also has calories. We don't know how much calories we are evacuating, so we don't know how much of it is getting absorbed. So if you have a 100-calorie pack of something, we don't know how much of those 100 calories was absorbed, whether it was 100 calories or whether it was 50 calories or whether it was 20 calories. So obviously it's very different. Now, 100 calories of broccoli is going to be very different from 100 calories of cookies, because of the way it acts in your body and the way your microbiome acts on it. So really, it's much more complex than just calories in, calories out. Because it's calories is a part of the story, and then hormones is the other part of the story.
Mm-hmm. So he answered. He said 3 meals a day, breakfast, fruits or boiled egg salad, and chicken or beef meal for dinner. What are your sides though? So are you skipping a meal? You're supposed to eat 6 times a day.
Well,
so look, come on, this is what you're here for.
so yeah, I mean, you're not. I know that's the other thing that a lot of times people are told, that you're supposed to eat 6 times a day, you're supposed to eat 4 times a day, you're supposed to eat 3 times a day, you eat 1 meal a day. It doesn't really matter that much. The problem with eating 6 times a day is you're always looking for things. The whole pretext
I
is
have
that
no problem finding them.
the pretext is that when you just want to eat so that you don't feel hungry, and then there's a tendency to overeat when you just want to eat so that you don't feel hungry on the next meal. And but having said that, when I lost my weight, I was eating 5 times a day. So really, it just depends on you. And I've done 1 meal a day, and I've done like no meal a day. I've done intermittent fasting also. So really, it really depends on what you think works for you. So there's no right or wrong answer here.
Yeah.
So
for me, when I ate more, I lost more than when my schedule's crazy, right? My schedule's just crazy. So when I meal planned and I knew what I was going to do and I knew what I was going to eat and I calculated everything and I portioned everything out, because for me, portion size is a huge thing, right? I remember my ex-husband, I remember coming downstairs and he's got my 4-year-old sitting at the kitchen table with a big old bowl of cereal, and it's a sugary cereal. So I was like, what did you give him? He was like, a bowl of cereal. I was like, bro, that's like 4 serving size in that bowl.
Yeah.
And he's like, it's a bowl of cereal. That's what it says. I said, no. Like, and I took it and I put it on the scale and I was like, do you see how much, like, just portion size, the half a cup of rice? Like, you're usually eating 3 cups of rice and don't even realize you're eating 3 cups of rice. But when I say the 6th time, right, I would have three strong meals where I had my vegetable and my protein and a little bit of fat. I try to stay away from the starches and the carbs, unless it was after workout. Like I had this whole schedule thing, right? And then my other 3 meals were like a handful of nuts, an apple. Like, so it wasn't something that was like a whole nother meal. It was like a snack just in between the meals to hold.
Yeah, well, I mean, I think you laid it out fairly well, because you planned your meals, right? So you knew what you were doing. So that's a very different picture than what a lot of people don't do. And actually, we know that meal planning works. We know that counting food journaling works. So even if you don't do anything and you just start journaling your food, what you're eating, you're going to start losing weight, regardless of what you're doing, because you're just noting down what you're eating. And I said that works. There's data to support that. that you can have weight loss just by journaling down what you're eating.
And I think go ahead.
Yeah. So, and the important thing is to note down everything that you eat, because what ends up happening is that you have a small thing here, a small thing there. You're like, this is just one thing that I'm eating. And what ends up happening is by the end of the day, you don't even know what you've eaten, except for those big meals that you ate. And all of them add up. So really, food journaling is very important, I think.
It is. My girlfriend says, I'm always hungry. Girl, you know me, you're going to talk later. But so I when I talk to a lot of people about eating and they're like, how did you lose the weight? And, the meal planning and portion size was huge for me.
Yeah.
A big thing. But the minute that I stopped doing that, I kind of started falling off track. Because like you said, the one little thing here, the one little thing there, you don't realize it adds up. And by the end of the day, it's like an extra 600 calories you just consumed without even realizing it. But people always ask, like, how did you lose the weight? Whatever. And they're like, I watch what I eat. And I ask them, do you watch what goes in your mouth? Like, do you just look at it and that's what you mean you watch what you eat? Because there was one time my father and sister were sitting at the kitchen table and they were pigging out on cherries and watermelon. And I was like, y'all could keep going. And they were like, and I was like, you do realize there is sugar content in that. You do realize so like everything in moderation. Fruits, yes, it's a fruit. But if you sit there and eat 5 pounds of cherries, like you should have just had a donut. Like,
well, no, you should still not have a donut. I would disagree there, because all of these fruits do have fiber in them, and that's really, really important. And they have other micronutrients in them that do add up. Now, obviously, everything should be in moderation. But what I would encourage actually everybody to do is, and I recently actually this Monday, my next episode that's coming out is all on the USDA guidelines that just came out for 2020 to 2025. And I know there was a lot of hue and cry about the amount of added sugar that they talk about. The research says it should be less than 6% of your daily intake, but they're still stuck to less than 10%. But really, I think they do lay out some very important stuff that I think people can benefit from as far as healthy eating goes. For example, how to use the My Plate model, how to use the whole grains. The only thing I have a personal issue with is the fact that they equate whole foods with 100% juices, which is I completely disagree with, and I'm sure every obesity specialist will disagree with. Juices are not the same as fruits. No. And I completely, I do not advocate for having fruit juices. If, God gave us teeth, so I think we can chew. So I think we should chew our fruits and not just sip on juices. Really, they're marketed as having rich in vitamins and this and that, but they're devoid of so many other things. And what ends up happening is, if you just end up eating, if you're sitting and eating an orange, you're probably going to eat 1 orange or 2 oranges, right? But if you're drinking a glass of juice, it's going to be like 5 oranges worth of sugar.
And do you lose some of the fiber when they put it into fruit juice? Are you losing some of that fiber?
All of it, because they're just squeezing the fiber, the juice out. That's it, right? So there's no fiber there. So even though they're sold as rich in vitamins and a healthy alternative, blah blah blah, but it's really sugar. And same goes for stuff like honey, agave, whatever, maple syrup. Even though they're natural products, they're from honey is from bees. It's very natural. It's not like processed sugar, but really it's still sugar. I mean, there's no other way of looking at it, but it is sugar. If you look at sometimes people actually, it's so funny. It just infuriates me. In the market you go and they just say organic sugar. I'm like, yeah, it doesn't matter. It's still sugar. Right? Yeah, are you kidding me?
Like I didn't know sugar wasn't, but okay.
It's just organic magically makes it better for you. Like, are you serious? This is so stupid. So no,
I do. So Dr. Sabharwal has mentioned that he has a podcast. So I do want to put this up here. If you go to his website, www.decodingobesity.com, you will find the links to all of his podcasts and all of his platforms. And I'm telling you, make sure you go over, follow, click it, like it. I'm telling you, it's a great source of information. So some of the information you're getting here, plus you're going to get so much more. So I'm going to leave that up for a little bit, and then I'll take it back down so they can see who you are. So I have a question from Dwayne again, but I'm not sure he's going to be able to answer it because this is all informational. It's not to be used as any medical advice. You should absolutely always speak with your doctor before starting a diet or exercising or starting or implementing any nutritions or supplements over the counter. Always speak to your doctor about that. This is just informational based on science. But his question is, and that's why I made that statement with the, do you recommend, what is that? I don't even know what that is.
Phentermine and exercise to help with weight loss? Yes and no. so, so let's say yes and no, because really we have to choose who is an appropriate person for phentermine. So phentermine, for those who don't know, it's a weight loss pill. If you were around the 70s, you would know that there was a huge fiasco about these weight loss medications causing some heart problems. But really, so phentermine was a part of that medication, but it wasn't the one causing it. It was the other one, was fenfluramine causing it. Phentermine has been around for a long, long time. It's a good drug that we use for weight loss, but you have to be the right candidate for it. And really, I can't decide. We can't decide this over here. You have to see your physician to do that. But it does work, and it does show a lot of success. It's actually one of the very successful ones. There's a trade. There's another form that's come out called Qsimia that has phentermine and topiramate in it, and that's also shown a lot of success, and that's approved for long-term use by the FDA. So yeah, phentermine is a good choice, and we do consider phentermine in patients who are appropriate candidates for it. Exercise, yes, exercise works. Well, not for weight loss, but it works. So yeah.
So you say that. Can you expand on that a little more?
Well, so data doesn't support that exercise works for weight loss. I mean, exercise works for weight maintenance, but not for weight loss. They're two different things. And so yeah, exercise is good regardless. I'm not discounting exercise. And so I'm going to broaden this. Okay, so this is going to blow everybody's mind. So let's just.
I'm literally sitting on my hand.
So we were discussing about this, right? That you had your trainer come on and talk about this regimen and exercise and this and that. But really, you have to look at physical activity rather than exercise as a whole. Now, what is physical activity? When you're not lying in your bed, you're physically active. Whether you're moving around, whether you're just fidgeting with your pen, whether you're fidgeting with your hands, whether you're just walking, whatever, that's physical activity. So you do a lot more of that than you do any exercise during the day, right? Mm-hmm. So basically, yeah, increase your physical activity. Do simple things like park further away from your office so that you can walk those extra steps. Take the stairs to your office rather than taking the elevator, up or down, either way. Any amount of physical activity is good. Any amount of exercise is good. You don't have to have 30 minutes in one go, and that's the only way you do it. You can do it in 5 minutes spurts. You can do it in 10 minutes. Even if you do 5 minutes, even if you do 1 minute, that's better than doing no exercise. But if you do too much of exercise, that also increases your hunger, and then you can start eating more, and then it might become an issue. So yeah, really, I mean, exercise helps, and exercise has a lot of benefits over and above just the weight loss. Well, it doesn't really have that much of a weight loss thing, but yeah, with high blood pressure, with diabetes, it sensitizes your muscles to the insulin, so your diabetes can get better. It has cardiovascular benefit, and has benefit with stroke, with depression, so many other things that exercise can do for you. So I'm not discounting exercise at all in any which way. In fact, I'm saying that exercise is super important for all of us. But let's make it broader. Physical activity is very important for us. So staying physically active during the day is very important. It's not like you sit. So data also suggests that if you do a sport of physical activity, following that you become completely sedentary, that's detrimental to you as well. So it's not like just being physical activity for doing, being physically active for 30 minutes or 45 minutes or 1 hour, and you're good for the day. No, you're still. So if you're still sedentary after that, that is detrimental to your health as well. So really, it's about being physically active throughout the day rather than that just having that set time for your exercise. So exercise is important, but physical activity is much more important overall than just doing exercise.
Yeah. So I feel guilted sometimes when I don't get up and go to the gym. And so I actually have a gym in my garage, so I don't even have to go that far, right? But I feel guilted, like, oh man, I didn't. But then when I think about what I did for the day, it's like I shoveled 100 yards of snow, I mowed a half an acre of yard, like I do, and I don't remind myself that, like, by the time before the day's even done, I look at my little Fitbit watch and it's like 10,000 steps.
Right.
I already went over them, and I have to remind myself that it is activity, right? It is.
Yeah, it's physical activity. That's really important. You have to be physically active, and that's where the key is.
Yeah. So we have Yolanda, who says she just started journaling last week. It makes me more aware of what I eat.
Yeah.
You gotta let me know how that works out for you. I definitely think I think what takes me away from it sometimes is because it's reality smacking me in my face. Like, you messed up. That Snickers bar, you need to put it down on that piece of paper, and you're not putting it down on that piece of paper.
So you want me to say another well over here? Well, it may not be you. So it's it's a lot more that goes into all of this. I just want you to look at it this way. Any food product that you're buying in the market, it's been heavily marketed to you, right? In some way or the other. Whatever it may be. There are billions of dollars behind all of this marketing. Now there's a reason for this, right? So they just tap into the unconscious part of your brain. And basically, they're what we call hyperpalatable foods. They have the trifecta of high sugar, high fat, high salt, or comfort foods, or whatever you may want to call them. Mm-hmm. So it's really, you may want to put it down, but your brain is saying otherwise. Mm-hmm. I don't know if you've had this experience. You go to the grocery store and you just pick up something randomly and you don't even know why you picked it up. And that will never happen to you for cabbage or kale or spinach. That will never happen to you for that. I can assure you that.
Yes.
So, and then you get to the checkout counter and you're like, why did I pick this up? I don't even know why I picked it up, but I've just picked it up. I might as well just take it with me. Yeah. So what happened there? You're not making that decision consciously. That happened unconsciously. That was like your brain tricking you to just pick that thing up. So there's a lot more going on than you realize. So it's very easy for somebody to say, well, you can do better. And, it's your willpower. But, this obesity, I call this obesity pandemic. I don't call it an epidemic. Well, this has really been going on for the last 40 years. So what happened in the last 40 years? Did people suddenly lose their willpower towards eating these foods, or they just decided that they wanted to be this heavier weight, or they just wanted to suffer from obesity? What happened?
No, it's been
did humans as a race just decide that we're going to suddenly, now we've had enough, we don't want to control what we eat? No, that didn't happen. I mean, everybody wants to be at a healthy weight. So there's a lot more that goes into all of this, Chrissy, because there's a lot of money being pumped into this.
Yeah.
And there's good reason for that. Mm-hmm. Because it's what we call, I mean, there's no clear-cut definition of food addiction per se, but the pathways that are activated are similar to the ones that are activated for addiction by these hyperpalatable foods. So that's really important to understand. And I think a lot of times what happens is people who have obesity kind of start blaming themselves, and the society blames them, and their loved, near and dear ones blame them. They all have good intentions. They want them to be healthy. But the problem is that, blame can only go so far. And really what ends up happening is even these food companies, they put the onus on the person. They're like, oh, well, it's there. We're not shoving it down their, down their face. So they have a choice whether they want to buy it or not. Well, not really. They don't have a choice. You just made it so attractive for the brain that the brain is not even thinking when it's buying this stuff. So yeah, really, they don't have a choice. You're just hijacking the brain. So really, it does hijack your brain. And so that's something that's really important for people to understand, that it's a lot more than just, so when that Snicker bars is staring at you, trust me, there's a lot more.
I've actually patted myself on the back a few times where I've had the Chips Ahoy cookies in my hand and I'm like, what am I doing? And I put it right back down, like, no, get out this aisle real fast. and I try to stay out of the inner perimeter. Like I try to stay
That's
on the
what we tell
outside.
everybody. Just stay on the outer perimeter. Don't go into the inner perimeter unless you need some of those staples. But otherwise, just try and stay away from all of this because really it's difficult.
And I feel like, and the way they market things too, right? It's not so false, right? It's not false advert. How can I put it? I guess it is false advertising, but you can't really like with the fat free, but not telling you everything else that's in it. Like what they supplemented the fat for, or because usually if something has less fat, it has more sodium, right, or something like that. Like
no, it's more sugar and it's a mess.
like if you ever grab like a bottle of low fat mayonnaise and then
so I would encourage your viewers to listen to my next episode that's coming out on Monday, because when I talk about this, how we got into this fat-free era and what all is going on. But I can tell you this, that if somebody wants to start eating healthy, I think the current USDA guidelines is a good place to start. I think that's a very good place to start. They have this thing called the 85-15 rule, wherein they say that 85% of the times you should eat a good meal, which they describe fairly well. And I was kind of impressed by what they say over there, barring the 10% of added sugar part. So that I think should still be 6%. And they talk about 2 drinks for men as far as alcohol goes, and 1 drink for women per day. But the data suggests it should be no drinks, or at the most 1 drink for either men or women. So those are the 2 big controversies that really happened with these guidelines that just came out. I think in December they came out. Okay. But they really, as far as healthy eating goes, they talk about the 85-15 rule, and I think that's a very good place to start, wherein you at least have something to start with, right?
I have a good question for you here.
Sure.
I can't wait to see your answer. Like diet soda versus regular soda.
Well, I would say no soda, water.
That's why
So there is some now this data is controversial, but there is data to suggest that even that the sweetness of the diet soda can cause your brain to think that it's kind of sweet, so it can cause some amount of insulin release. I don't know how important that is as far as obesity goes, because insulin is a very big driver of obesity in the body. But yeah, I would say no soda. I would say plain water is better than soda.
What about carbonated water? Like
you can have carbonated water. That's fine.
Because for the most of the part, it's usually that carbonation, right? It's that fizzle, that bubble. That
And you can add lemon to it. It tastes good.
Yeah, but I know her. She's not doing any of that. And then I think you mentioned where it's a good place to start. But
I think I was very pleased with these guidelines that came out. The USDA guidelines. I think that's a very good, except for the fact that they mentioned 100% juices, which I do not agree with. I think it should be whole fruits, and they talk about, actually, they talk about canned fruits and whole fruits and 100% juices, and they say you can have a mix of that. I would say stick with the fruits. Don't the whole fruits. Don't go to the canned fruits or the juices. I would say just stick with the whole fruits, because really.
What about if you juice your own fruits and vegetables?
Doesn't matter. Juice is juice.
Okay. All right.
Juice is like soda without the fizz.
This why bother, right?
Yeah. And it's interesting, a lot of times people will make smoothies out of stuff. Like you'll have some of these brands, I don't want to name any brands, but some of the brands have smoothies and whatever on the in the island. They're like, oh, all natural, they have no added sugar, this and that. But what ends up happening is when you're blending something in the blender, you're really destroying the fiber. You're really destroying it into such fine particles, because then what ends up happening is the sugars are more readily absorbed. And even though that fiber, it's just completely destroyed. It's a mush, which normally would not happen when you chew the food. So
that is good to know, because after my workout, I make my protein shake and I add a banana and some frozen strawberries in it.
Well, I mean, once in a while it's okay. It's not like you can't do that. It's just about the fact of how much you do that, and it's
I work out 5 times a week.
Well, it's okay. It's better than juice.
Yeah, well, I do, because I don't like the protein powder just like that. So when I add a strawberry and some frozen bananas, then it kind of makes it more palatable for me.
No, absolutely. I mean, I'm not saying that it's completely out, but I'm saying that, yeah, limited. That's all. Look, am I saying that you should not drink juices at all? No, I'm not saying that at all. I'm saying if you enjoy something, there has to be a fine line where what you enjoy and what you eat. At the end of the day, food has to be enjoyment. It doesn't have to be drudgery, right? It doesn't have to be torture. So
Right.
you have to enjoy your food because that's a very big part of our of us as humans. We enjoy what we eat, and really, it's about making those healthier choices, finding those healthier alternatives to things that we love, so that we can have something healthy and then yet not not have the recommended effects. For example, switching over to brown rice. Now, what happens with rice is when they dehusk the rice, it's what you get is the brown rice. When they remove the bran of the rice is when you get the white rice. So that's the polished or the white rice. So you need the bran to be there slightly better than the white rice. So that's something that you can do.
Yeah, that's what I've changed. I don't do white rice anymore. I do the brown rice when I do rice.
Yeah.
Most of
The
the
other
time.
thing, the other thing that I do is I buy whole grains like whole wheat, not whole wheat bread or anything, but like whole wheat,
Yeah, because
whole
those are
barley,
too.
whole wheat, whole sorghum. You can buy quinoa if you want.
Yeah,
I
I
think
like
quinoa,
quinoa.
I think quinoa is overrated, but you can buy quinoa.
So I
But
like it.
so yeah, you can buy all of these. You can buy cracked wheat. You can buy whole oats. So even the oats that are like the Quaker oats and whatever, they're okay, but they're steamed and they're flattened, so the surface area is broader. So the absorption of the sugars is a little more than you would get from like the whole oat groats. So you
Okay.
can buy these. You can start with that really, and
What do
it's
you think
not.
of so I love the Kashi Goleen cereals. What's your take on them? I want to know if they're getting debunked and I should stop buying them.
Well, I mean, you can buy it. Look, they're okay.
They say 9 grams of fiber per serving.
Yeah, that they have a lot of fiber. They have a lot of fiber. I'll give you that. But it's all, I don't know what it's. It's very processed. Honestly, I would rather have those your whatever regular oats that have that any day of the week. But again, you have to have that fine balance of enjoyment and
Chocolate
so it has to be a fine balance. It cannot be, don't do this and you cannot do this. And if you do this, that's the end of the world. No, that's not the case. Of course not. And that's why I impress upon the fact that, the 85-15 rule, because really 15% of the times it's fine. I think even if it's up to 20%, it's fine. As long as you're good 80% of the times.
So I want to bring up Yolanda. She says, I struggle with sweets. I had to cut back. I'm trying to replace it with better food. So what would be your recommendation, like when somebody has that sweet tooth, what should they reach for instead of the chocolate bar?
So actually, I would say just cut out all sugar, and it's very difficult. And I will be very, very honest here. It's very difficult in this country to cut out sugar because they hide it in so many ways. It is almost impossible to cut out sugar in this country. Like I've never had such a difficult time cutting out sugar in my diet because it's so funny. I was looking at one of those packages I was buying in the grocery, and I always look at added sugar, and it said 0 grams added sugar. And I'm looking at the ingredient and it says cane sugar. I'm like, are you kidding me? Are you lying to me? Like, there's this is no added sugar, and there's added sugar. So it's like, what's going on here?
Mhm.
So it's very difficult, and I agree with that, and I acknowledge that it is going to be very difficult. But the way you can start is by just shopping around the periphery of the grocery store, because that's where you'll find all the fresh produce, and really just stick to that. Try and cut out sugar for a week, 2 weeks, and things will change, because I did this and I know this works because it worked for me. I at one point in time I cut out sugar completely from my diet, and you'll have those cravings initially. And when you have those cravings, just take a piece of dark chocolate, a small piece of dark chocolate. Don't take the milk chocolate, take the dark chocolate,
Mhm.
70%, 80%, and just put it in your mouth. Don't bite, don't chew it. Just put it in your mouth and just let it melt. And even a very small piece will really satisfy your palate, and it'll just calm all of that down. So you'll not have the craving after that. So I've done that; it works. But just be mindful. Don't go for another piece, because chocolate itself, yeah, it can be difficult.
It's a
So you have to be. Yeah, so you have to. It's an effort, but after a while, you'll not need it, because what ends up happening is once you're off of the sugar, that's what I experienced. I did not crave it anymore. I was not looking for something sweet to eat, and I was a person who used to love sweets. Like I would just gorge on sweets. So yeah, that worked for me. So I think that's a good place to start. It's going to be tough for the first 2 weeks, 3 weeks, but really you'll find a difference once you're off of this sugar.
Yeah. And I implore the viewers to really start to investigate the foods you're eating, right?
Right.
Like I have a granola bar here that I'm not going to show because I don't want to advertise the company. But
Sure.
it's supposed to be healthy and it's crap. It's garbage. It's nothing but sugar. Like you
Right.
think you're eating like this healthy protein bar or this healthy granola bar, and it really isn't any of that. So really investigate your food, look it up, and if it's natural and it was grown out of the soil or, came off
Yeah.
a tree or something or was a livestock, then more than likely,
Anything that doesn't have a label, I think is good. It's a good place to start.
yeah.
Anything that doesn't have a food label is a good place to start.
Absolutely. So I ask everyone because we're hitting that hour mark, and I mean I had a great time. I don't even want to stop. I want to keep going. But gummy bears are his only vice. They have sugar.
Well,
They have sugar.
they're all sugar. They're just sugar. They're just sugar. They're just pure sugar.
And once you take it in, that's it. It's like that effect. Your brain gets stimulated. It's that
Yeah.
addiction that's happening.
Yeah, so there's starting to data to suggest that sugar is actually sometimes they did studies in mice, and they found that sugar was found to be equal or more addictive than cocaine. So it's addictive. It's an addictive
I was
substance.
gonna
Yeah.
make a joke, but maybe it's not appropriate. I was gonna say just go for the Coke, but no, I meant Coca-Cola. Just
So yeah, so it's very addictive. Sugar is addictive,
yeah.
and so we have to really try and stay away from that. I think that's, I would say, start with the USDA guidelines. That's a very good place to start, and start cutting out added sugar from your diet. And that's, if you do these two things, as far as lifestyle goes, these are good places to start.
And you wean yourself, right? You
Of
don't because
course.
yeah, if you just automatically stop that said I'm done, you're gonna start craving because you wanna the way you were taught to eat, you've gotta slowly unteach yourself to eat that way as well.
It can be different for different people. Like even for example with smoking cessation, there's no data to suggest that cold turkey is worse than slowly tapering it off. So cold turkey may work, and slowly tapering it off may work. Similarly for this, if you taper it off, like how do you quantify how much sugar you're going to eat in a day? You can't quantify that. Like how much added sugar you're going to eat in a day? You're going to say I'm going to eat only 10 grams of added sugar in a day. You just can't calculate that.
Yeah.
So I would say the best way is to cut out as much as possible, as fast as possible, of the added sugar, and just stick with it. It's going to be a rough ride for the first 2 weeks, 3 weeks, because you're going to have those sugar cravings. It's going to be for the sugar cravings, right? But once you're done with it, you'll feel better. So yeah, and then the other thing is that if you're suffering from obesity and you're stuck and you don't know where to go next, and you've tried everything, and I mean everything, honestly, that can be a condition where you've tried lifestyle and it's not working for you. Then seek the help of a professional, of an obesity specialist, because really there are things that we can do. Modify your diet, modify your exercise, give you medications, advise surgery. Depends on what your condition is. And really, and all of these things work because we know that it is a disease. We know that we need to do something to control it. Yeah. And it is a chronic disease, yeah.
There can be an underlying condition that you're not even
aware of. Of course, we have to evaluate so many things. There are medications that can cause you to have obesity. There can be underlying conditions that can cause you to have obesity. There are psychiatric disorders that can cause you to have obesity. And then, if you have one of the psychiatric disorders like binge eating disorder, nighttime eating syndrome, diet is out of the window because you have something else that's causing you to have that. So really it's trying to figure all of that out. So it's much more complex than calories in, calories out, and what people make of it. It's really a lot more than that.
Yeah, definitely. So listen, the other thing that I want to throw in there too is if you are a family person where you have children or a spouse, it's usually better when the whole family does it together.
Oh yeah, I have a phenomenal episode on that, and I'm not going to mention that. It's going to come out So this Monday is going to be on the USDA. The one after this is another one. If you're looking for, finding out about how others can help you, do tune in and ask your other family members to tune in, because they will have a lot to learn from that episode, because I really take a deep dive into this, how we can help each other. So yeah, I have 2 phenomenal episodes coming up.
I have a final question that I
Yes.
ask everybody. So the first one and the last one, always the same. And then I want you to tell everybody where else they can find you,
Sure.
like you just did. So the last question is, what is one piece of lasting advice that you can give the viewers?
So what I would say is, start with a proper goal in mind. And I would say, basically take small steps. Each step counts. Remember, it's a journey. It's not going to be one destination that you'll reach. When you start, you'll have a destination in mind. Where you will reach will be a completely different destination. Trust me on that. But you'll be happy that you took that journey. So I would say, start small and build upon it. Really, you can't. Rome was not built in a day. So that's what I would say.
Perfect. Thank you. So you can find Dr. Sabharwal at www.decodingobesity.com. Again, tell us, just in case they weren't listening, what are the next 2 episodes? What can we find there?
So the next one is on the USDA guidelines, where I take a deep dive into it, the history of the USDA guidelines and how this came about and what happened and what are they recommending now. So if you don't, it's I think a 40-50 page document, or maybe probably like 100. No, it's 100 something page document. But I do not delve into the pediatrics world because honestly, I'm trained in internal medicine. I'm an adult physician, so I don't delve into the world of the kids. I stay away from that. So I talk primarily about the adult nutrition there, that whatever they talk about, break it down, give my thoughts. So that's the next episode. And I think if you really want to know how to start eating healthy, I think that would be a good place to start. The one after that is going to be very, very important if you're trying to find support when you're losing your weight, because I'm talking all about accountability and finding accountability partners and what should be the good characteristics and what should not be done and what should be done, and how, if you're feeling stuck with your accountability partner, what can you do? So all of that I'm going to be talking about in the episode the week after. So I'm really excited about these episodes. And even if you look at my episodes from the previous year, from last year, all of them have been kind of, I break down some of the common things that we come across, so that it's basically bite-sized information for people to understand and the science behind all of this. So yeah, I'm very excited about this.
Thank you so much for coming on. I'm telling you guys, definitely go check it out. I was listening to it the other night, and it's an easy listen. You can go back to it. It's there for you to continuously listen to. He has intermittent fasting in 3 different parts. I'm telling you, he breaks it down. You're not there for an hour like you are with me, but it's there. It's all helpful, evidence-based information. I want to thank you so much for coming on. This was a big deal for me. I appreciate it immensely. Hopefully we can have you come back on and delve into some more stuff.
Absolutely. Yeah.
I usually always end the show with my little slogan, which is, if all you've experienced is all you know, then you are in a deficit of knowledge. So thank you guys for joining the Cipher. Thank you for commenting. Thank you for watching. Make sure you head over to decodingobesity.com. Check Dr. Sabharwal out. And that note, everybody, again, thank you. Don't forget, tomorrow I do have another show. Today was a special show. He had to come on.
I'm honored. I'm humbled. I'm humbled and honored that he had a special show for me. My God.
Absolutely. When I connected with you, I was like, oh no, we have to do this. Like, it has to be top of the year. So guys, thank you so much. And I will see you tomorrow. One love.